President should also provide the budget. But Honorable Speaker, let me even go a different way. Because many members were asking the differences between NHIF and SHA. And for surgical tariffs, across all providers, any surgery, they are unstandardized across all the providers. Before you could go to a private hospital, they charge you a different amount that is charged in the faith-based, that is paid for in the private. But now we have said any surgical procedure, whether it's you go to Aga Khan, or you go to a county hospital, or you go to a faith-based hospital, it is standard. 2, the tariff limits have been increased by 12% under SHA. And I want members to look at even the law we have passed. Every tariff, every benefit tariff have been increased by 12%. Under NHIF, the limits were different for different facilities. Different hospitals were charging differently. And Honorable Mama Degorot, Beatrice, let me agree with you. Healthcare is very expensive. And it depends on which hospital you choose. So you must be very careful which hospital you take your patient to. There are hospitals, private hospitals in our country, that if you stay for 5 days, you get a bill of 11 million, when it should be 2 million. I have concerns. So I think in previous parliament, we have discussed the cost of healthcare in our country. Before this House, Honorable Speaker, my committee, led by Honorable Dr. Nyikal, is looking at quality care and patient safety bill. I think we must do amendments to that law to deal with the cost of healthcare in our country. In other professions, lawyers, their costs are regulated. We must regulate as a country. I'm sure those who are doctors who are in this house and the ones who work with me will not be very happy, but we have to say it. The difference between NHIF and SHA, emergency evacuation will soon be launched. There is the ECCIF. Once we do the emergency evacuation, the ambulance will be paid for by SHA. The first 24 hours will be paid by SHA. That never used to happen under NHIF. All Kenyans now will have an access to an ambulance. The days when a patient is taken to a hospital or an emergency and you are asked for deposit is over with Social Health Authority. These are the benefits. SHA will pay for the ambulance. SHA will pay for the first 24 hours. The only package that I think the feedback we got, and we get a lot of feedback. We have a call center, 147, that every day over 5,000 to 10,000 Kenyans call. We get feedback from leaders like you. We get feedback from citizens on their concerns. But the Social Health Authority, the Social Health Insurance Act, the Primary Health Act. Let me tell you the biggest difference between NHIF and SHA. And this is now where I should want to thank this House and the leadership of this country. Primary health care paid by the Exchequer at level 2, level 3 and sub-county hospital is free. You walk in, you walk out. Now let me come to the question of my sister, Samburu West. Yes, if you ask me, if you put a question on those who are co-charging, I will provide. But I think complimenting the ones who are doing good work, I think I'll do it. You know, it's members who oversight. Mine is implementation. But I agree with you. It is criminal, it is unethical, it is immoral for when this House has appropriated resources for Kenyans who access outpatient through the primary health care fund. And the money is supposed to go to the facility as capitation. You're asking Kenyans to buy exercise book, to pay for laboratory. Mr. Speaker, that is immoral, it's a constitutional criminal even in the law that you have passed. And I think a time will come when we shall shame those facilities and in those counties, whether even my referral hospital, if they charge extra than what is provided. On St. Mary's, Honorable Speaker, even if I was a resident of Kakamega, maybe my children also could have been born there. But let me make it very clear, Honorable Speaker, I've even given you the data as one of our leaders. St. Mary to date, SHA has paid 114,548,896. The claims which are with us, which we will pay in November, which is this month, is only 5.5 million. I went to Kakamega myself. I sat with the whole team, our Lord Bishop. We sat with the whole team, the bankers, the SHA team. We reconciled. We did a press conference. But that is a faith-based facility. I cannot go and open it. Now that I have given you the amount of money, the one for NHIF is a legacy debt, just like Consolata Madari Hospital. Honorable Speaker, St. Mary has become a political hospital. I cannot go and open. I am ready to go with you, but I told the Lord Bishop, when you're opening, call me. I'll even bring extra drugs from the Ministry of Health. We are waiting for the day to be opened. So let me send my good brother, please, 114 million have been paid by SHA. 5.5 he will pay. The reason why it's not being opened is beyond my control. It's the way if Nairobi Hospital today closes, and I have paid them the money, and maybe they want to go and open a hotel, there's very little I can do. Honorable Speaker, so St. Mary, that is the case, but we are, as a Minister of Health, we are working, and I really want to ask both Professor Undo and my brother Kibagendi that I need to get the details of those two patients and see those particular hospitals. We have hospitals that also want to co-charge people. They don't want to use the right tariff. It's called decoding. But I'll ask Mercy and myself, Honorable Kibagendi and the professor, just share with me so that we check from the system, and if we feel there is a problem, we will go resolve it. It's part of the feedback we want. But we are working on to reduce the cost of healthcare. Number one, by introducing reforms in the KEMSA, making sure we do bulk procurement to reduce the price of drugs. We want to do contract manufacturing. We want to do strategic purchasing by SHA. And that's why we also introduced the next program where hospitals don't need to pay for equipment, neither the county or the national government. Vendors bring their equipment, they put it there. The number of Kenyans who use that, then SHA will reimburse those vendors based on the number of patients that go through. Honorable Speaker, on Mheshimiwa Jalango, in the journey of UHC, countries must make a choice.